Hi, I'm Dan Endress, and I'm here to talk about the adults ages 19 to 64 with no medical bill problems or medical debt quality indicators on the national scorecard. When we think about the great changes occurring in healthcare, we continue to hear about improved insurance coverage and how insurance is helping to cover medical costs. Yet when people go out to seek healthcare, they are faced with many different challenges. Let's look at this picture. Do you think this man laying here is looking and worried about who's going to take care of him? Will his health insurance be covered his medical needs? Probably not. He just knows he's in need of medical intervention despite the cost, and he's hoping somebody will come take care of him. When nearly 2 million people faced bankruptcy in 2013 as a result of medical bills. Imagine 2 million people facing bankruptcy in 2013 as a result of their medical bills. Mangan, 2013. The citizens of the United States are questioning if and when they should go seek out health care. They may question, is my health insurance good? Are they providing the care I need? Are my copays affordable? What about my deductibles? The questions they have are real. They want to know, should I really seek out health care today? Should I be able to go get health care? What about my provider? Are they going to accept my health care if I get a new insurance carrier? All these questions are real to millions of people. In the last couple of years, it was noted that more than 25 million people are skipping out on medication doses, taking less medications, delaying the refills of prescriptions to save money. How is this impacting our healthcare of our nation? We're seeing a lot less debt as a result of healthcare, but it's resulting in more health issues for people. Megan, 2013. No one should be put in the position to wonder if they can afford something in order to survive or not. Keehan, 2014, reports that nearly 40% of the debt in the United States is related to healthcare. It was also reported that 63% of Americans have received a medical bill that was much more than they expected. This same article points out that the cost of a GI procedure in two different facilities can have a price tag of more than 54% difference. When people seek out healthcare, they don't ask for a price list or a menu of the cost of things. Why? Why isn't equality across the board? Why isn't one healthcare facility charging more than another? Why do the people have to have unfair costs despite where they go? This project is really looking at scorecard indicator 34, those between the age of 19 and 64 with a medical debt or problem. The scorecard looks at the number of people without any medical debt or medical bill problems. It was reported in 2011 on the card that 60% of those had no problems. So what does this mean? It looks at and sees if people are able to pay their health care benefits, their premiums, their deductibles, or do they have to charge it, or do they end up in collections? How do we get this data? It's collected by the different organizations, and it looks to see who's being put into collection agencies for bills, who's had a change to the way of their life due to not being able to pay medical bills. Are they having to pay their medical bills off over time? Over the last couple of years, in 5 years, we saw 34% of people with no medical debt, and in 2010, now we're up to 40% of people with medical debt. Is this related to the cost of health insurance or the premiums that they're paying? Let's look at an average American citizen working at the local housekeeping department in a hospital, even if they make $12.50 an hour. Working 36 hours a week, they make $900 before taxes and all their other expenses. Now we take out their medical family plan for $125, they're down to $775 a week. Mortgage or rent? What about their utilities and gas bill? This leaves them maybe $100, $150 a month. Now they get injured and sick. Call for an ambulance. That's $50 for a copay. They get to the hospital, $250 for a copay. The referral out of the ER, even more. Now you have to follow up with your primary care provider, maybe a specialist, $40 copay there. How about those prescriptions you need filled? $10 each. Oh, you needed $40. Boy, that didn't help us very well. Look, bills are adding up, and these people have no way to pay for them. They end up in debt and end up having to claim bankruptcy and other problems. 8 out of 10 medical bills out there now contained errors. One study that showed that 49% of Medicare claims in a small 34 hospital study had some type of billing error, Glover 2014. What's the difference between the hospitals with these different tests? Why aren't they fair? Why aren't they consistent? It was reported that unpaid medical bills have lowered credit scores 40 to 100 points, Kuzan 2014. Imagine the impact this has on our economy overall. When people are losing their homes or other investments due to healthcare costs and debt, our entire economy is going down because of this. It's time Congress gets involved and looks at some sort of single-payer system. In 2005, as I mentioned, 34% with medical bills with no medical bills or debt. 2011, 40% with a medical bill or debt. What's going on? Why aren't these numbers changing? Why aren't they increased? Why aren't we at 100% with no health care insurance? Maybe it's because the cost of premiums is going up faster than the cost of inflation. Maybe it's because we haven't put into effect the proper mechanisms to slow down health insurance companies and hospitals and healthcare providers for increasing their rates. So what can we do? What are the solutions? Well, over a couple years, we've had the Affordable Care Act. This has increased education to consumers that they need to shop for healthcare, ask for pricing, choose a place that can provide quality care at an affordable price. The Affordable Care Act has also helped regulate administrative charges that insurance companies can spend money on. They won't let premiums increase because these administrative costs are going through the roof. The American Affordable Care Act has allowed American young adults up to age 26 remain on their parents' health care plans. It's also provided us a tax credit. Hopefully, with the right balancing, we'll be able to get health care insurance to cover what our income is. And so our income is not greater or not less than what we need to pay out. Medical insurance, deductibles, co-pays should not burden the American people and shouldn't land them in debt. So what's the solution? Moving forward, I had asked that we look at a single-payer healthcare system in this country. Let's stop allowing insurance companies to run up premiums, out-of-pocket costs for the American people. Let's have a health insurance program that is equal for all American people. Let's have health insurance that won't wipe out savings account and cause bankruptcy because of medical costs when ill or injured. Let's have a program that allows for accessibility and inclusive healthcare for all the people of this country. Let's have no more billing from hospitals. Let's have no more being tied down to a job because you can't change jobs because you're afraid your new insurance won't give you the same coverage you currently have. Let's make America a place where a hospital state is not equal debt and bankruptcy. While we wait for this system to come out, I ask that we look at enacting legislation that has a limit on out-of-pocket expenses for individuals on health insurance and healthcare costs a year. Let's make a system that's based on income. You make $100,000 a year, you have to pay out at least $5,000 in premiums and other healthcare costs before you're at your cap. If you make $30,000 a year, maybe you only need to spend $2,000 a year before we put a cap on it. Maybe if you have children, $500 or $1,000 a year cap. Let's make America healthy. Let's quit wasting money on health insurance premiums. Let these people use the money to help increase our economies at the local level. Let's build a stronger America. This program would place the limits on out-of-pocket expenses incurred by each person and would let our economy grow. America's insurance companies are some of the fastest growing industries in the world. Why don't we put a stop to this? Make insurance companies pay for what they should, the health care of our citizens. Thank you.